Bonjour.
Hello, and welcome to our Spring 2022 series on the well-being of veterans and their families. The objective of the series is to provide information on the evolution of pain management, current best practices, and evidence-based interdisciplinary care. My name is Ramesh Zacharias, CEO and Medical Director of the Chronic Pain Center of Excellence for Canadian Veterans.
I would like to take this opportunity to thank our presenters today. Our first presenter today is Dr. Gregory Hariton from the Michael G. DeGroote Pain Clinic, who will be speaking about mindfulness. Following Dr. Hariton, we will have Neil Pearson from the University of British Columbia with veteran partner Dawn Herniman as they explore evidence-based research surrounding the impact of yoga in pain management. Thank you all for joining us today. Now I would like to present our moderator for the session, retired Lieutenant General Michel Maisonneuve.
Merci beaucoup, Dr. Zacharias, et encore une fois, bonjour à tous.
Thank you very much, Dr. Zacharias, and hello, everyone.
I welcome you to another in our series of webinars on veteran and family well-being. Today, as usual, there are two streams to choose from, a French language stream and an English language stream. We are doing simultaneous translation so we can serve both streams, and all the support material has been translated. You should also be aware that the presentations and slides are best seen in full screen mode. Les deux présentations aujourd'hui seront en anglais, mais avec traduction simultanée et diapos en français dans la version française.
The two presentations today will be in English, but with simultaneous translation and French slides in the French version. We will have two presentations today and take questions after each of them. I am very happy to facilitate this webinar. I myself served for 35 years in the Canadian Armed Forces, and like many, I left with some injuries that caused me pain. The Chronic Pain Center of Excellence for Canadian Veterans conducts a lot of research that has already provided help to our chronic pain veterans, their families, and the clinicians who care for them. The series of webinars are intended to provide updates on the evolution of pain management methods and current best practices in real data-based interdisciplinary care. Presented in an accessible way, these webinars are for veterans, their family members, medical professionals, case managers, and researchers. They have as a recurring theme the importance of prioritizing the overall quality of life of a veteran and their family using a comprehensive multidisciplinary approach that helps guide the chronic pain management program.
Two very interesting and cutting-edge aspects of pain treatment alternatives, or rather additives, mindfulness and yoga. Notre webinaire d'aujourd'hui traitera de deux aspects novateurs qui peuvent s'ajouter au traitement de la douleur chronique ressentie.
The webinar today will talk about two new innovative aspects that can be added to the treatment of chronic pain felt by some of our veterans.
Professor at the Michael G. DeGroote Pain Clinic at the Hamilton Health Science Center.
I'm now going to introduce our first first speaker, Dr. Gregory Hariton.
Incorporated a program in the use of mindfulness training in these patient populations and has seen encouraging results. Sa présentation aujourd'hui traitera de la pleine conscience comme méthode utile pour comprendre l'impact de la douleur chronique du côté psychologique de notre bien-être.
His presentation today will talk about mindfulness as a useful method to understand the impact of chronic pain on the psychological aspect of our well-being. You'll see that pain increases stress, and stress affects physical well-being. It's a type of vicious circle. So I would like to introduce Dr. Gregory Hariton.
Thank you for inviting me to speak to the group today. As you can see, my name is Greg Hariton. I'm a professor at the Michael DeGroote Pain Center. I also work as an addiction counselor or addiction consultant at another program. And I mention that because that's what sort of led me into the interest that I currently have in mindfulness, in the management of chronic pain. Because with an addiction program, mindfulness and meditation is a big part of treatment. And from an observation that I made over the last 15 years is oftentimes patients that would come for addiction treatment that would also have concurrent chronic pain. I found that with our program over time, there was less of a complaint, higher function, reduced pain, with all that was involved in our addiction program. So I thought it was important to clarify that, because that, as I say, that's what made me start to research. How could this be useful in our pain program? So I'll start off. So first of all, we have to decide why do we want to even talk about chronic pain in Canadian veterans? And I had a chance to look back at this survey, and as you can see there, the Canadian veterans are almost twice as likely to report chronic pain than the general Canadian population. So it is a significant issue, and it's something that needs to be addressed. You can also see there that they also showed higher past year prevalence of depression and panic disorder. And there was also approximately double the incidence and prevalence of generalized anxiety disorder as well in the Canadian veterans. So what I'm going to touch on, and again, whenever I sort of look into something new involving treatment of patients, I like to go back and sort of discover what is the history, where did this come from? And essentially what we're going to be talking about is, as you can see, Eastern mysticism versus Western medicine. So really that's what's happened, is that these are treatments, and these are things that have been used in the East, predominantly India, for what I could trace it back as far as 5,000 years. And it's just something that had not been a large component of Western medicine. And I'll touch on that as to how that sort of got introduced into our medical field. So where did it come from? As I said, it goes back to the initial documentation that they could find was a text that actually described 112 different meditations, and this was over 5,000 years ago. As we fast forward about 2,500 years ago, which was the time of Buddha or Gautama Siddhartha, and that was sort of the beginning of mindfulness meditation. So you can see, for 2,500 years, it was a huge part in the Eastern world. It wasn't until the 50s and the 60s that we started to see it develop into North America. And that was with the Transcendental Meditation movement, where there was a world tour by a famous yogi that came here and introduced that to North America. Jon Kabat Zinn, who was a physician out of Boston, really started to popularize it in medicine, and predominantly for stress reduction. And that was in the 80s. In the 90s, the Oxford University developed mindfulness-based cognitive therapy. And then finally, I put in there, because in the 2000s, Dr. Gardner-Nix, who I did my initial training with about 5 years ago, has developed the mindfulness-based chronic pain management. And that's the program that I offer, or that I certainly am involved with in my chronic pain patients. And again, I like to put this up because there are a lot of other benefits. We're going to talk about how it affects pain. But this was an interesting quote by Buddha. He was asked, "What have you gained from meditation?" And he replied, "Nothing. However, I have lost anger, anxiety, depression, insecurity, fear of old age, and death." So what I want you to take from this is that there are a lot of other benefits that in some cases far surpass the actual benefit in reducing pain. But certainly that is something that you will notice if this is something that you decide to take on. One part of this is, the pain is something. They say that pain is inevitable, suffering is optional. So suffering is how much that one resists the current state of affairs. So as one resists the chronic pain that one is experiencing, it starts to enhance the suffering. So part of mindfulness meditation is it reduces, obviously it will reduce some of the actual pain. You'll see pain scores come down, pain sensitivity will come down, all of these things. But it will also reduce the actual suffering, which is when one starts to bring in emotional components and resist the actual condition, and it accomplishes nothing but increasing the symptoms. So mindfulness practice, okay, so again, it's reducing the suffering. And what are the things that we target? Okay, so it's attachment to thoughts, to outcomes. Okay, it's wanting physical states to be different. Okay, so again, it's coming back to trying to accept the pain. Relentless mind activity. Okay, so we talk about catastrophizing, and I'm assuming everybody that's on this talk is probably suffering from chronic pain. So you've probably gone through a catastrophizing questionnaire, and we see that is quite common in chronic pain sufferers. A deep-seated habitual responses to the world. So we start to see that ways that one reacts can start to be modified with the practice of mindfulness. And the scrambling for security. So again, it's developing attachments to things, and that can include addictions, can include different types of behaviors to try to establish some type of stability or groundedness. And what we see is that some patients have an attachment to their pain. Obviously, that they've had it for certainly more than 6 months, but some for years or decades, and it becomes very familiar. And I've actually had patients tell me, I don't know who I am if I don't have pain, because it's been such a big part of who they are. So definition, I'll start to go through some of these more quickly because I do understand that I have a limited time. So mindfulness, this is Jon Kabat Zinn from the 80s, is paying attention in a particular way on purpose in the present moment, non-judgmentally. So that's how he defines mindfulness, and you can see there the different characteristics. His research, again, this was initially based on the mindfulness-based stress reduction. And you can see that the patients reported being happier, more energized, less stressed. Their lives were more meaningful, more control over their lives, and more likely to see challenges as opportunities rather than as threats. So those are some of the benefits. Okay, we haven't even got to the aspect of pain reduction. Again, more benefits. I'll skip over that because we are really short for time. So we can't talk about mindfulness and chronic pain without talking about stress. And stress has plays such a huge factor, not only in aggravating pain, in some cases causing pain, and in some cases interfering with the body's ability to heal. Okay, so we'll touch on this. Not too much detail, but enough that you see how it's correlated, because a big part of meditation is helping to reduce this stress so that one is able to see the benefits of the mindfulness meditation. Okay, different types of stress. Okay, so eustress, it just means good stress. So there actually is good stress. And it's something that's indoctrinated into our, to each human being, and it's our survival mechanism, right? So if we're presented with a physical threat, we have a stress response, right? The fight or flight response to enable us to survive, to fight or to run. And that's typically associated with acute stress. Unfortunately, there is distress and chronic stress, which is stress that is ongoing, and not just days, but it's for weeks, for months, for years. And I would suspect that a large majority of the population, not just chronic pain sufferers, do suffer from chronic stress, which is a form of distress. And again, that's a perceived stress. So people start to identify things that they react as though it's life-threatening, from relationships, from different just day-to-day life activities. So it's something that we will see that mindfulness will help as well. So physiological homeostasis, the body always wants to return to a baseline, to a homeostatic mechanism. And that's done through the autonomic nervous system, okay? And that's where meditation starts to work, okay? So one goes from the sympathetic nervous system, the fight or flight, and that takes them to the parasympathetic system, which is your rest, digest, and repair, okay, as you can see there. And that's also linked to the endocrine system, which we'll touch on quickly, is another one that's mediated by a hormone, cortisol, which is the prime, I guess, culprit for maintaining chronic stress and interfering with the body's ability to repair itself and to rest, and keeping one in that fight or flight high cortisol state. So I could have picked 100 of these. There's so much research out there that talks about how stress is not good for us. Okay, so these are just some very examples that I managed to pluck out of the research, out of the data. So adverse emotions, chronic anger, anxiety, depression, associated with increased pain and increased opiate requirements. Lack of forgiveness, resentment. Okay, so somebody that's blaming, that feels somebody's responsible and has this deep sense of hatred or dislike for somebody or something. Sometimes it's an organization, an insurance company, is associated with persistent low back pain. So again, that's something we always ask about in our histories is this an insurance case? Because if there is that factor, it really does affect how one will respond. So that is something to keep in mind. Fibromyalgia, huge correlation with trauma, physical, mental, sexual trauma. Okay, so we have to keep moving along here. So again, factors that influence suffering. So essentially what we're targeting here, it's this what's called chronic autonomic dysfunction or imbalance. And again, these are not just chronic pain sufferers or people with mental illnesses. This is the general population, right? So a lot of us are suffering from chronic autonomic dysfunction, and which is why that you're seeing that this mindfulness is becoming extremely popularized. Okay. Stress and healing. I mentioned this before. It interferes with your healing. So if we can get somebody engaged in an ongoing mindfulness program, there's no doubt we don't know what the result can be in terms of one able to heal from what initially caused their chronic pain. Because if you're in that chronic sort of sympathetic fight or flight state, one has a very slim ability to heal wounds or heal damaged tissue. And these are just, again, a few examples I plucked out of the research. Alzheimer's caregivers for Alzheimer's patients, which are felt to have a high degree of stress, they found that small wounds, would take an average of 9 days longer to heal than in control patients. Stressed people exposed to colds and flu have more severe symptoms. Medical students' immune systems have been documented to plunge at exam times, and healing after back surgery is much longer and is affected by a past history of childhood adverse reactions. So again, that's just something to keep in mind. Just a quick little joke here. When we do look at stress, a lot of times we want it quickly. We don't want to, invest the time. So what are some of now we're going to touch on what's some of the data, okay? Because I find it's important to express to patients, and I do this when I teach my mindfulness program, is I do present data so that people can actually see where these changes are taking place. So this is a study that was done with people meditating for only 20 minutes for 5 days versus control group that were doing what's called progressive relaxation. And they found there was an increased activation to some parts of the brain there. You can see that. Well, I'll show you exactly where that is in the brain. This was done by a functional MRI. And they also had an EEG, or electroencephalogram, running. And they found that they had an increase in theta waves, which stimulated directly the autonomic nervous system, and specifically parasympathetic nervous system activity. So that's the rest and digest, as we talked about. And also, people with the stimulation of those particular centers, it also had a direct effect on activation of the parasympathetic nervous system. They found that with the relaxation it did not produce the same results. So you can see alpha waves were found in relaxation, which is considered to be deep relaxation, and theta waves, which is considered to be the foundation of deep meditation. So it really was a difference in how the brain responded. So yes, relaxation is fantastic, but it doesn't have the benefits of mindfulness meditation. And just to show you where those are, this is if you cut the brain in half. You can see there on the left, and there's the different regions. So it's around the connection of both hemispheres, which is called the corpus callosum. You can see the anterior cingulate gyrus, the prefrontal cortex, both involved. And then this is on the right is the lateral aspect of the brain from the outside. And it's a small part of the brain called the insula, which is actually your attention muscle. So if one pays attention to the present moment, that's the part of the brain that's involved. And those are all areas that are stimulated with mindfulness meditation. I'll skip over this. I just wanted to give you a sense of where this plasticity came from. So there's changes that occur in the brain that are sustained, not only structurally, but also physiological changes, which you can see here, it's just called Hebbian learning, which is the phrase that you hear, neurons that fire together, wire together. So the more that you start using another part of the brain, you actually will start to see that functioning. And another study. So this is another study, the direct influence of meditation on the opiate system. So again, it stimulates those same parts of the brain we talked about. And what does it do? Okay, by frontal cortex stimulation, it actually acts through what's called a hypothalamus, through a specific nucleus, the arcuate nucleus, and it increases the production of endogenous opiates, okay, or endogenous endorphins. Those are your painkillers that your body produces. The other thing, as you can see on the right, it reduces stress. And as we reduce cortisol, that actually increases the effectiveness of these endogenous opiates, where they become, the binding it enhances the binding, and the efficacy is increased. So you can see that Zen meditation actually has a direct effect on the pain system. Again, brain activation, this is the same thing, where you can see it's always those same areas of the brain that are activated. And what we found is that the meditators had a lower pain sensitivity. So they were less sensitive to the same painful stimuli. And then morphology, this is just, I like to show this, it just shows that there actually is a loss in cortical density and amount of cortical structure as we age, and also with chronic pain. So the longer you have chronic pain, there's actually more brain atrophy that occurs. The reason I show this is not to make everybody depressed, but the fact that this can be reversed. Both aging and the chronic pain reduction in brain density and tissue can be reversed with mindfulness meditation. Again, just another benefit. It decreases pain unpleasantness. So you can see on the bottom of that graph, as you increase up to its number of weeks of meditation, patients report decreased pain unpleasantness all the way from 6 down to 2. And again, just a change. Other benefits one sees, again, this was research done by Dr. Gardner-Nix. Not only the pain, as I said, that's a huge part of it, but they found that their hobbies were increased, their recreational activities were increased, physical activity. So people were actually enjoying life, their quality of life improved. And finally, this is the last study that I'll mention. This just compared chronic pain patients, looking at mindfulness meditation versus cognitive behavioral therapy, and they found them to be very similar in terms of efficacy. And one could eliminate the previous treatments and could find the similar or even better results in reducing pain with both of these types of therapy up till 4 months. At 6 months, the mindfulness still was documenting decreased pain, improved function, and at 1 year as well. Whereas the cognitive behavioral therapy, the effect seemed to wear off after about 4 months. So that's just to show you that, yes, it's cognitive behavioral therapy is also effective, but the mindfulness far surpasses that. So finally, our summary is that the chronic pain remains a significant issue among Canadian Armed Forces veterans. As we documented, it's twice the incidence. Mental health diagnoses have to be have an increased prevalence, and they have to be treated concurrently. And again, those are the programs that we try to offer so that we're addressing both problems, and that mindfulness can be extremely effective adjuvant therapy, treatment modality for chronic pain and concurrent psychiatric conditions, but it's just part of. So it's part of all the other therapies that one has been introduced to. And then finally, the neuroplasticity, that the neurological system can change. And these are permanent changes that can occur, both in structure and also physiologically. And then we'll have some time for questions, and we can delve into some of this in more detail. So thank you for your attention.
Merci beaucoup, Dr. Hariton, pour cette excellente présentation. I found it very
Thank you, Dr. Hariton, for your excellent presentation.
Stress, pain, healing, and how mindfulness can help. So now we're going to move on to questions, and first questions from you, our audience. And I know you touched on this on your presentation, but is there firm clinical evidence that regular mindfulness can reverse the chronic pain neuropathology?
Oh, yes. So first of all, I just want to thank everybody for your attention and for allowing me to participate in this educational session. So, because I was limited with time, when I do this presentation with my mindfulness patients, I present many more studies, it's many more slides, and I show much more evidence. But there's no doubt, and you can see from the initial studies that I did present in this talk, that it can be as early as 5 days of 20 minutes per day of mindfulness. You can start to see physiological changes in the brain. You can see shifts in cerebral blood flow to those certain areas of the brain that are involved in helping to reduce pain, helping to activate the parasympathetic nervous system. And certainly the longer term meditators, and one of the studies there followed patients up to 10 years, is when you start to see the more permanent changes, both in function, and that's the neuroplasticity, as well as anatomically. So there's a wide range of spectrum in there as to when these changes occur. But yes, they are changes, but they do depend on one's commitment and regular practice of mindfulness.
Yeah, and I know you talked about this a little bit during your talk as well, but what about the comparison to opioid treatment for pain management, between that and the results you get from alternative methods such as mindfulness?
Yeah, and that's a very interesting topic, especially now with all the controversy about opiates and and risks involved in overdoses and addiction. There are some encouraging studies, and one that I did point out there is the direct effect of mindfulness meditation on the body's endogenous opiate system, where through mindfulness meditation, and most of these studies are based on an 8-week program where somebody is meditating, just to give a context, tends to be somewhere between 5 to 7 days per week for a minimum of 30 minutes is when you start to see these changes. And then also by the reduction of stress, you can actually increase the binding capacity and effectiveness of opiates. So you can actually, using it concurrently with opiates, you can enhance the effects. Thereby, you can start to decrease opiates. And I'll just mention lastly the last study that I presented there about low back pain versus cognitive behavioral therapy and mindfulness therapy. That was actually a study where the controls were patients that were on what they called usual therapy, and the vast majority of them were on opiate medications. And in those two cases, up to 4 months were relatively equal for mindfulness and cognitive behavioral therapy, equal in efficacy in reducing pain as the opiates or usual therapy. And then up to 1 year, you had equal results and similar efficacy with the mindfulness as compared to usual treatment. And again, which did involve multiple medications, but in most cases did include an opiate. So there is a significant benefit in either being able to eliminate or even reduce opiates.
Yeah, that's very interesting and very useful. So now that we see that evidence is mounting for the usefulness, of mindfulness. And why, in your opinion, is it so hard for clinicians to obtain approval for funding for these seemingly cost-effective strategies? I don't know if this is, you undoubtedly have an opinion on this.
Yes, part of it. I mean, there's a lot of education that really needs to take place, and I think it needs to start with the medical community. For example, I do offer this program. Certainly, I haven't been able to conduct it since COVID, but I would have it about every 6 weeks. I would do one of these programs, and I would be based on referrals from other physicians. And very rarely am I getting referrals from physicians within our department. So I mean, I think we have to start to get out to educate other chronic pain doctors, anesthetists, other family doctors that are practicing chronic pain management, so that they can become aware of some of these studies and the benefits. So I think it has to start with the medical community, and then even with patients. I would have patients referred and they wouldn't show up. I typically would take 12 patients per course, and on average I would have 5 patients actually show up for the course. So I think it's got to start with educating both patients and the medical community as to the benefits. And I think from there, in my opinion, I think this is the future of management of many issues, not just pain, but also several of the mental health concerns.
Yeah, and hopefully these education sessions and webinars that we're running are also going to help a little bit. And I guess my final question for you, Dr. Hariton, is how can a veteran get access to mindfulness training or care? Where can they get access to these resources? Where can they find the resources?
The number one that I would recommend, and again, I have no financial interest in this, but I took my course through. It's called Neuro Nova, NEUR. RO Nova, Nova, and that's with Dr. Gardner Nix in Toronto. So that's where I did she does physician training to teach this program. They have physicians that are linked to that particular program that will teach online Zoom courses for chronic pain management, mindfulness-based chronic pain management. So that's one. So the internet is a great source. The other is the mindfulness-based stress reduction, which is the program that was started in Boston, and you can actually access that if you just Google it, and that's you can find that free of charge. So those are probably the two easiest resources that somebody could access very quickly.
Well, thank you very much. Merci beaucoup, Dr. Hariton.
Well, thank you so much, Dr. Hariton. We're now going to our second presenter, Dr. Neil Pearson and Ms. Dawn Herniman, that I'm now going to introduce.
Neil Pearson is a Canadian leader in pain management, an adjunct professor at the University of British Columbia, and an experienced physical therapist and certified yoga therapist. With a BA in Health and Physical Education and a Master's of Science in Rehabilitation from Queen's University, Mr. Pearson is also founding chair of the Canadian Physiotherapy Pain Science Division. As an aspiring writer, he has authored books on yoga therapy for pain and is the recipient of many awards from the Therapy Association and Queen's University. Mr. Pearson is an engaging educator and a compassionate clinician, able to make the complex understandable, willing to share his knowledge and expertise in pain care, and always eager to learn more. He feels his most influential mentors and teachers have been the people in pain that he has served. For her part, Ms. Dawn Herniman has served 30 years in the Canadian Armed Forces, retiring in March 2018 as a personnel selection officer. Her varied career saw her become a parachutist, serve with the Skyhawks, and she was also the subject matter expert in resilience at the Conduct After Capture Center. As you may know, the CAC Center, among other training, helps prepare military personnel to resist interrogation if captured. In a quest to find relief for her chronic pain, her mental health injuries, and her stress, Dawn more deeply explored some of the practices she taught at the CAC Center. This path led her to evidence-based, trauma-sensitive yoga and meditation practices, some of which are alternative medicine treatments offered at American veterans hospitals. Neil and Dawn will discuss yoga as a therapeutic add-on to other pain treatment. I can tell you from prior experience that it is sometimes hard to convince a veteran that yoga might help their pain and help their mindfulness. All the veterans I've spoken to who were skeptical at first, for example, at St. Anne's Hospital in Montreal, were pleasantly surprised after they started a yoga program, and later they even deemed it essential. Both Neil and Dawn will provide more information on this topic. Merci à vous deux pour votre présence et je vous passe maintenant la parole.
Hello and welcome to...
Thank you to both of you for your presence here, and I would like to give you the floor now.
Therapeutic intervention. My name is Neil Pearson. I'm a physiotherapist, and I'm a yoga teacher, yoga therapist, and clinical assistant professor at the University of British Columbia. So it's quite an honor to be joined here today by Dawn Herniman, who is a veteran and originally yoga skeptic. So, and it's also really great that the Chronic Pain Center of Excellence for Canadian Veterans has given us this honor to be able to present on this topic. So we're going to start by just mentioning we all have biases, and Dawn and I are going to try to mitigate our biases by clarifying levels of evidence. Just because it's important for you to know, I'm a consultant to LifeMark clinics across Canada, as well as to other groups like the Division of Family Practice in BC. I'm also director of my own company, which integrates pain science and yoga. So we have a few learning objectives today. The first learning objective is to have Dawn present her experience with using yoga as a therapeutic modality. And then we're going to talk about the evidence around two sort of aspects of yoga, yoga for well-being, but also yoga as a therapeutic intervention, and then talk about some of the pros and cons. So I'm going to pass it over to Dawn to take it from here.
Hi, yes. So I have 30 years of military experience. I had 2 years in the reserves, Naval Reserves, and 28 in the regular force. My background, I did ROTP, so I have a BA in social science and psychology, and I also did my master's degree in psychology. My career was unconventional, I guess, and I did my jump course, my basic parachutist course, military free fall. I was on the Skyhawks. I've also done research and taught at the Conduct After Capture Center. And I got into yoga trying to care for the injuries that I experienced as part of my my career. So I broke my back in '94 on my basic parachutist course. I sprained my SI joint. I've also broken fingers, separated my AC joint, just like a number of injuries. And part of my healing journey was yoga. And that's what I found that worked for me. And because I wanted to learn more, I got into taking more and more teacher courses. So I teach mostly trauma-informed yoga. And trauma-informed yoga, well, part of the barriers that I experienced in my care was that when it came to yoga, none of the, VAC wasn't supporting yoga as a treatment. It wasn't being supported in some of the other centers of excellence as an actual treatment modality. And then when I was talking to some of the doctors, they said, yeah, just do yoga. So there's a lot of different types of yoga. And not every type of yoga is the saying is that yoga is for everybody, but not and for everybody. So it's but you have to pick your yoga. Okay, so there's a range of yoga from extremely physically challenging to very very relaxing and meditative. So it's finding what works for you in that, and also finding instructors that are trauma informed or trauma sensitive in studios. And in Canada, we just don't. I wasn't able to find studios or instructors who knew how to deal with people who had experienced trauma. And just going to a regular civilian class, I found it was triggering. Like, I wasn't able to get the full benefit of yoga. And when I looked at what the US VA hospitals and clinics were offering, it was all trauma-informed types of yoga. And getting into the benefits that I have experienced in yoga, it's great to be able to focus on one thing during your day. And if it's just becoming centered and listening to your body, being in your body, being in the present experience and focusing on your breath. And it just gives you peace from negative thoughts, peace from, your experiences during the day, and just allowing you to relax and to be. And I experienced immediately, like sometimes immediately, different, days can be different, but immediate improvement in pain, my tension, moods, and it gives you that ability to respond to whatever events are happening to your day instead of reacting. So it increases, it improves your interpersonal relationships, and it teaches you as well that you are not broken. Right? When we go to a lot of other types of therapies, you get a feeling that there's something wrong with you, or that, that you're not right. But yoga teaches you that you are whole. It's just finding, getting into that experience. And then it also taught me kindness to myself and self-compassion. And that is one thing that I really needed. And I think we seldom get it in the military. Kindness seems like to be a weakness sometimes. That's been my experience. So that's what yoga has brought to me, and why I continued my yoga journey.
Thanks, Dawn. I almost feel like we don't need to say anything more. I mean, those benefits are so important, and we just don't get them. After years of working in pain management centers, we aspire to do these things, but we often don't get those same results from a lot of people. And so, just as an explanation, everyone, yoga is many things, but one of the things that we can say it is a system of teachings, techniques, practices, specifically intended to decrease suffering. And that's what it's about, is to try, as Dawn said, realize you're whole, you're not broken. Yoga typically has a bunch of different parts to it. There's the techniques about how we act in the world, how we treat ourselves. There's the postures that most people know about, the breathing techniques most people know about. But there's also things that lead you into meditation. There's the looking inward and then getting better at focus and concentration, and then stepping into meditation. And then beyond that, even learning how to connect to self and to others and the world in new ways, which we often need to do when we have chronic pain and injury. We can provide yoga in different ways. The yoga that Dawn went through, I think, is mostly yoga classes. And so yoga classes typically have these 4 parts. You start at the beginning, being present, more aware. Then you start to work on regulating your breath in certain ways. Then you start to move your body in sort of gentle ways, and then increase the movement of the body often. But then at the end, no matter what you did in the middle, there's this part of relaxation and integration, which science shows us is a really, really great way to learn new things. Now, when you do yoga, part of the benefit we think around veterans is that there's a pattern or a ritual, so you know what's happening next, and that's really important for a lot of us after injury. But in yoga classes or yoga for well-being classes, you're asked to conform to what the teacher is teaching. Whereas in yoga therapy, there's the switch to, in yoga therapy, what we're doing is we're teaching people how to specifically modify and adjust what they're doing based on their specific pain condition or injury to allow them to succeed with the yoga. So this is more of a patient-centered, more individualized, and you can do it in small groups. I've taught that way for many years. But it's really nice if you can actually see people one-on-one first, because if you can see people one-on-one with yoga therapy, then it's easier to help people modify once they get in. So yoga therapy can be directed to a specific assessment finding, or it could be directed to the person. So say the person is having anxiety with lifting after a back injury, is that what we could do is put different parts together. We could bring in a breathing technique that we know sort of calms physiology. We could ask the person to begin a mantra or affirmation that we know would also find some calmness for the person, get the person to do kinesthetic imagery or imagine moving with more ease, even before the person actually does the postures or the movement. And for those of you who work in pain management, you realize this is like progressive exposure, but from a yoga perspective. I wish I had time to tell you about all the research because I'm a research geek, but there's lots of research around this. We know the research says there's systematic reviews that say yoga helps people with chronic pain conditions, whether it's low back pain, neck pain, osteoarthritis, rheumatoid arthritis, even things like fibromyalgia. We know that one study showed that yoga for people with low back pain was not inferior to physiotherapy, so that's important around access and cost. What we don't have is research around the one-on-one effects of yoga therapy yet. No one's done this. A U.S. veteran study looked at yoga for well-being, and they found these amazing effects. I mean, the second point here is at least 80% of the veterans said that they had at least a 33% improvement in things like pain, energy level, depression, anxiety. That's pretty amazing for yoga for well-being classes. We also know that there's evidence around yoga for veterans with chronic pain. So, veterans are unique. Yet the research says that it works well on veterans. The research has been done. A 2020 study on veterans with chronic low back pain showed that the veterans, when they added yoga into their standard care, there was an improvement in back pain and disability from what they had with standard care. Again, that's pretty impressive to get that added change. And we know there are research gaps as well. We don't know things like what are the yoga teachers actually telling the veterans about pain, because we know lots of people in the medical world don't understand pain really well. So we need to sort of learn these things. We need to learn other things like, as Dawn mentioned, most of the research doesn't have veterans receiving yoga from trauma-informed and pain care-aware teachers and teachers who understand the uniqueness of veterans. Because as Dawn mentioned, it can be not that hard to get triggered by the sort of typical language of yoga. Can be triggering to lots of people. And again, as I said, the research gaps, so we don't know about the one-to-one yoga therapy. So yoga for well-being has pros and cons. Everything does. We think yoga class for well-being is really great for prevention and maintenance. It's cost-effective. It can be convenient. And we know that a lot of veterans have movement-evoked pain and that this could continue to help them even when it's not a medical condition. The cons, of course, are the fact of having teachers who might create adverse effects. And then there's access issues, as Dawn mentioned about. We may need to have gender-specific and veteran-specific classes so that this will succeed better. Yoga is therapy. The pros really are patient-centered, fewer adverse effects, that you can address the specific needs of the specific person and modify things. So there's benefits to this. And then also the cons that we know basically are the cost and the access. So we wanted to really just give you two perspectives. And so we'll wrap this up with these two perspectives of a clinician and a veteran's perspective. As a physiotherapist since 1985 and a yoga teacher, yoga therapist since around 2 decades now, I think that all three of them are valuable. They all have different roles and purposes. Being able to continue with yoga in the community, yoga for wellness, is an excellent thing to be able to do after treatment. And I think that we've got good enough evidence that says that yoga as therapy, whether it's small group or one-on-one, would be advantageous within pain management programs. So, Dawn, if you could just wrap up with your perspective, that'd be fantastic.
Yeah, so for my perspective, yoga is really critical in healing and reestablishing that mind-body connection so you can actually, often we find that there's a connection between or a link between chronic pain, depression, and PTSD. Okay, so basically what I've found is that yoga is critical for healing and reestablishing that mind-body connection and making talk therapy more effective. So it's also studies done in the US, usually by VA hospitals, are finding that pharmacology, yoga that is more effective than just pharmacology and talk therapy alone. And yoga gives us more agency over our wellness. So we can have control over our own wellness and we have less dependency on pharmacology. And with PTSD and things like depression, it's so important to have agency, to have some sense of control. And yoga through meditation and breathing and all the other techniques gives us tools that we can use anytime, anywhere. And research also conducted in the US finds that female veterans are significantly more likely to seek yoga over any other type of treatment.
Well, thank you very much to both of you for this fascinating presentation, and I found it perfect as a natural follow-on to the mindfulness presentation we just had before. So some of these questions are going to be the same as the ones to Dr. Hariton, but for example, in terms of pain reduction, how much pain reduction are you seeing with yoga, and compared to opioid for pain management?
And maybe I'll jump in right away on that, Dawn. The research really shows, if you look at people with chronic pain using opioids, that there's often on a 10-point scale about a 2-point drop in pain when you actually take opioids. Excuse me. What we know from the research around adding yoga in, that it can drop the pain for about a 1 point on that 10-point scale. So it's not quite as much. And there are some studies that actually show better improvement than that. But if you look at overall, it's this 1 point decrease. And I think when we say that, we also need to point out something that's really important is this idea is not only does it decrease pain, but it helps you sleep better. It makes you less stressed. It makes you less depressed. It makes you less anxious. So you get all these other benefits. Whereas opioids may have a better decrease in pain, they actually can cause adverse effects that you don't typically get from yoga.
And if you look at the costs associated with between opioids and yoga, and the medical costs of opioid abuse, then we're talking some significant savings. So even if it's the same amount of relief, when you're looking at the fewest harms and fewest costs, opioids against yoga wins out.
Yeah. Neil, you also talked about the importance of meeting one-on-one sometimes with a patient before a class, but generally, do you include pain education in your classes so that people know that if they have chronic pain, it's not dangerous and that yoga can help?
Absolutely. I don't know where to separate those anymore because, and to me, it's also that we can use things like mindfulness and yoga actually as pain education. So we can provide pain education through me just talking to people or people reading things, but the embodied experience that you can get from doing yoga of, hey, if I do this, I can actually move with more ease and be less, have less pain at the end, can tell people that movement isn't dangerous through experience, which is far more powerful for a lot of us than me just telling you that it's okay to move.
Dawn, you want to add something to that?
I think Neil hit that one right on the head, right? From my own experience, I know that I needed to move, right? When you're dealing with massive depression and you kind of don't move, you stop moving, so all that fascia gets all tight, and as soon as you start moving, and then you participate in yoga, you have a yoga routine and there's predictability, and then you're getting to sense and feel your body again. It's so important.
I like that aspect of predictability is one that we don't, often think about, but it is. So the next question is one that I also posed to Dr. Hariton regarding why is it so hard for clinicians to obtain approval? So he gave us his opinion. Do you guys have an opinion? Why is it so difficult to get funding for these strategies?
You start, Dawn.
Oh boy. Okay. Well, I think there's a lot to do with the fact. I guess it's the culture of the medicine. Okay, and it's changing to a patient-centered approach. And in the U.S. military and the VA hospitals, they required an executive order to include complementary and integrated medicines such as yoga and meditation and acupuncture and a whole bunch of other things. So since 2006, there's been some form of meditation or yoga to treat veterans who either have chronic pain or PTSD or any number of mental health concerns. So it's there. They're actually treating people right now, and they have for almost 2 decades in the US VA hospitals, but they have the infrastructure. In Canada, we still don't really have that infrastructure. So it's a lot of changing educating healthcare providers and getting money out there and advertising that it is a good treatment. You should see some of these videos from the US of veterans who've tried yoga, and they're just blown away at how effective it is.
Neil?
I guess if I could add, the answer to the question is it's not about the research. Because if we look at the research, there's as much positive research around this as there is around a lot of physical therapies and exercise therapies and CBT. So that's not the issue. The issue is getting the knowledge out. The issue is getting people, as Dawn said, to change their perspectives. And then we have the added issue around yoga, because yoga is not one thing. We need to make sure that people are getting yoga that actually matches veterans, that is trauma informed, that is pain care aware. We need all that to happen as well. So there's a bunch of different avenues that we need to go to make this work properly.
Okay, and last quick question. Same one as for Dr. Hariton. I mean, it's hard for veterans to sometimes navigate the whole process. And so where can they go? Where can they find more information and get access to safe and gentle yoga practice?
Do you want me to take this, Neil?
Yeah, no, I'll finish with one brief thing.
Okay, there's a lot of online resources that you can use from the States. So there's Warriors at Ease, there's Yoga for Vets, Yoga Warriors International, Veterans Yoga Project, iRest, Yoga Nidra, the International Association of Yoga Therapists. The Veterans Health Administration in the U.S. has videos. All of these websites have videos that you can do at home. Exalted Warrior Foundation, Connected Warriors.
I think, Dawn, what I'll ask is if you could send some of those websites to Paul at the Center of Excellence, and we can maybe get them on our website. So thank you very much to both of you. Merci beaucoup, Neil et Dawn, pour cette présentation et pour vos réponses à nos questions. This information will definitely
Thank
help
you so much for your presentation.
and work through some of these issues. Alors, c'est tout le temps que nous avons. Merci beaucoup à tous pour votre participation.
This is all the time that we have. Thank you so much for your participation, and thank you also to our presenter for presenting and answering the questions. We have now seen I think that all the knowledge that has been presented here will help to Canadian veterans receive treatments for chronic pain.
Bringing hope to all those suffering and to their families. As you know, we emphasize interdisciplinary care and services for chronic pain management, where different healthcare professionals work together and share the same philosophy regarding the treatment of chronic pain and teach patients strategies to deal with their own pain condition. Le centre est aussi en train de créer un réseau de cliniques.
The center is also creating a network of interdisciplinary clinics from coast to coast to coast, which will allow all Canadian veterans to receive treatments for their chronic pain in an accredited clinic. In these clinics, we encourage a dialogue between the veteran and the clinician to ensure that they get the best care possible and engage the veteran. Remember that help is available and that you should stay hopeful.
On our website, and any question you might have can also be asked through our site. Please do not hesitate to contact us for any information you may require. Et aussi, je vous invite à nous donner vos...
I'd like to invite you to provide comments on the sessions that we've offered you. So these sessions that take place twice a year, are they useful, yes or no? And please don't hesitate to suggest topics or changes that you would like to see.
Not Wednesday, but Tuesday on the 14th of June at noon Eastern Time, that will deal with the use of psychedelic drugs such as mushrooms and ecstasy for the treatment of pain. We hope you can be with us for this session. So on behalf of the Chronic Pain Center of Excellence, thank you for your presence. Merci beaucoup à tous et à la prochaine.
Thank you for being here with us.